Greetings, and thank you for attending this online presentation or webinar about the rights of people with disabilities to have their essential support persons, caregivers, or attendants with them in hospital in light of visitor restrictions associated with the COVID-19 pandemic crisis. My name is Andrew Robb. I am the staff lawyer at the Disability Law Clinic at Disability Alliance BC, or DABC. I'm coming to you from my home on the traditional, ancestral, and unceded territories of the Musqueam, Tsleil-Waututh, and Squamish peoples in what is now called Vancouver, British Columbia. I originally presented this webinar on July 22nd, 2020, and it will soon be available on DABC's website, along with a transcript of the original presentation. I want to take a moment to tell you about DABC and the Disability Law Clinic. DABC is a provincial cross-disability advocacy organization committed to supporting people with disabilities to live with dignity, independence, and as equal and full participants in the community. We champion issues impacting the lives of people with disabilities through our direct services, community partnerships, advocacy, research, and publications. The Disability Law Clinic is a brand new program of DABC. We just opened in March 2020 as the first nonprofit law clinic in Western Canada to specialize in disability-related areas of law. We are funded by the BC Law Foundation to provide free legal advice and assistance to people with disabilities throughout BC in disability-related areas of law. I'm showing a slide that lists some of the areas of law that we practice in and our contact information. I'll put that up again at the end of this webinar, and you can also find it on DABC's website at disabilityalliancebc.org. During my presentation, I'm going to discuss the following topics. I'll start with a brief overview of some of the laws that create rights for people with disabilities and how those laws apply to the issue of essential support persons in hospitals. Then I'll refer to some resources for advocating with hospital officials to ensure that hospitals allow people with disabilities to have their support persons or caregivers with them, despite visitor restrictions related to the COVID-19 pandemic. I will also discuss the government's policy about support persons and caregivers in hospitals and what led to that policy. And finally, I want to talk about some of the legal options available to people with disabilities who have been prevented from having their support persons and caregivers with them in hospital due to visitor restrictions, including the option of complaining to a patient care quality office or to BC's Human Rights Tribunal. So let's begin by briefly going through the different laws that create rights for people with disabilities who need healthcare services. I will start with international law, namely the Convention on the Rights of People with Disabilities, or CRPD. The CRPD is an international treaty signed by Canada and over 160 other countries. As it says in Article 1, its purpose is to promote, protect, and ensure the full and equal enjoyment of all human rights and fundamental freedoms by all persons with disabilities, and to promote respect for their inherent dignity. Article 25 says that persons with disabilities have the right to the enjoyment of the highest attainable standard of health without discrimination on the basis of disability. And Article 12 says governments must take appropriate measures to provide access by persons with disabilities to the support they may require in exercising their legal capacity. These are very important rights, and as a result of the CRPD, they are part of international law. Now, the CRPD does not apply directly to BC hospitals, but it is supposed to inform government action and policy in a general sense. Then there is the Canadian Charter of Rights and Freedoms, which is part of the Constitution of Canada. Section 7 of the Charter protects the rights to life, the liberty to make fundamental life choices, including choices about healthcare treatment. And Section 7 also protects the security of the person to ensure our bodily integrity is respected. Section 15 of the Charter guarantees the right to equal benefit of the law without discrimination based on physical or mental disability. Canadian courts have repeatedly found that these protections apply to people with disabilities in hospitals and other healthcare settings. Then there is a provincial law called the Human Rights Code of British Columbia. Among other things, it prohibits discrimination based on mental or physical disability. This means that when a person with a disability requires any kind of service, including healthcare services, the service provider must accommodate that person within reason. Now, that's a very broad rule, and it can be difficult to say how it applies in any specific circumstances. But I am suggesting it means that for people with disabilities who rely on support persons or caregivers, hospitals must generally allow those support persons or caregivers to enter the hospital. Of course, it is reasonable for hospitals to restrict their visitor policies during the pandemic crisis due to the risk of infection and spread of COVID-19. But I believe the Human Rights Code means those visitor restrictions must be narrow enough and flexible enough to allow people with disabilities to have their support persons or caregivers with them in most situations. Now, I'm going to come back to the Human Rights Code later in this presentation. But first, I want to mention one more provincial law called the Healthcare Consent and Care Facility Admission Act. This law sets out the rules for how people consent to healthcare treatment. This law is especially relevant to people whose disabilities affect their ability to communicate or their capacity to make their own decisions. Among other things, it says healthcare staff must communicate with patients in a way that is appropriate for those particular patients. It also says that where a person is unable to make their own decisions, healthcare providers must seek consent from a supported or substitute decision maker, such as a representative with a representation agreement. This law also specifically acknowledges the role that close relatives and friends play in assisting people who need accommodation to understand decisions related to their healthcare. So that gives you some of the legal context for the issue of essential support persons and caregivers in hospitals. But sometimes what the law says is different than what happens in real life. So next I want to talk about how those laws apply in practice. In other words, how to advocate for yourself with hospital officials to ensure your support person or caregiver is allowed into the hospital with you. Since the beginning of the pandemic crisis, I have heard from people with disabilities who are concerned about this issue, who fear that they may not be able to rely on their support persons or caregivers if they are admitted to the hospital. I understand some people have even postponed important medical procedures or appointments out of concern that they'll be prevented from having their support persons with them. So I want to give you some resources if you are facing a situation where hospital staff may decide that you cannot have your caregiver with you. And the best resources that I am aware of for people who find themselves in this position in British Columbia are on the website of an organization called the Family Support Institute of BC at familysupportbc.com/COVID. If you look on that website, you can find a toolkit that they have prepared for people with disabilities in healthcare settings. They also have a toolkit available for the parents of children with disabilities who may also have to enter healthcare settings. The Family Support Institute is a fantastic resource for people with disabilities and their families. They are very experienced at advocating with healthcare officials, and I encourage you to contact them if you need support in dealing with hospital administrators. The information that I'm going to be sharing here is taken from their online toolkit. There are a few items that you should consider bringing with you if you have to go to the hospital during the pandemic crisis and you're concerned that your support person or caregiver might not be able to come into the hospital with you. First of all, you should consider preparing a letter to the hospital staff explaining your situation, and you can ask for that letter to be included in your hospital file. In my next slide, I'll show a basic template for the letter, and you can also find it in the Family Support Institute's toolkit. If you have a representation agreement and it refers to your support person or caregiver, you should show it to hospital officials. A representation is a legal document, and it shows that your support person is an important part of your healthcare team. If you can get a note from your doctor or therapist ahead of time to explain your need for support, it's always a good idea to bring it with you to the hospital. Hospital staff might take it more seriously because it's coming from another healthcare professional. You could also bring a copy of the official Ministry of Health policy about support persons and caregivers in hospitals. I'm going to talk about that policy in more detail in a few minutes, and you can also find a copy of it in the online toolkit. Finally, you should also bring all your communication aids and/or electronic devices, mainly because there's always a possibility, unfortunately, that hospital staff might not allow your support person or worker into the hospital with you, and it's prudent to have a backup plan. That is, a plan for how to communicate with hospital staff if your disability affects your ability to communicate. And also, a plan for how to communicate with your support persons and caregivers if they can't be with you. In my next slide, I'm showing a template of a letter that you can print out and fill in and give to hospital staff if you have to go to the hospital during the COVID-19 pandemic. A copy of this same letter is available on the Family Support Institute's toolkit, but I wanted to put it on the slide to give you a general idea of the information that you want to convey to hospital officials if you have to advocate for your support person or caregiver to be allowed in the hospital with you. The letter says, "Dear healthcare provider, I am a person with a disability and I require the presence of a support person with me in healthcare settings. My support person can advise on the areas where I need support if I am unable to do so directly. Based on the guidelines as outlined in the Ministry of Health Communique number 2020-01 dated May 19th, 2020 regarding essential visitors, I am entitled to have this person accompany me in the hospital. As the ways I need support are personal to me, my support person will be able to assist me, and this will make your job much easier as well. When I am calm and supported by people who know me, you will be able to focus on my acute care needs. I require accommodation and support in the following areas." And here there is a blank space for you to fill in your specific requirements. The letter then goes on to say, "If you are not able to allow this, kindly allow me and my essential support person to speak with the hospital administrator or administrator on call, as I wish to have an immediate review of your decision." So that is what the letter says. Now, unfortunately, there's no guarantee that the strategies in the Family Support Institute's toolkit will have the results we want. The final decision about whether your caregiver or support person can enter the hospital with you is up to the hospital. But I believe that the strategies I've discussed here are your best options, and in many cases, they are effective. Some people have asked me if it is a good idea to inform the hospital ahead of time about your support persons or caregivers. In other words, to contact the hospital before you even have to go there and ask for assurances that your support person or caregiver will be allowed into the hospital with you. This is a tough question, and I honestly don't know what is the right thing to do in this situation. You always have to walk a fine line between advocating for yourself and antagonizing healthcare officials who may seem quite sensitive. All I can say for sure is you have to use your best judgment, and it's always helpful to be polite and respectful with hospital staff. Now, before I go any further, I want to pause and acknowledge that part of the reason that I wanted to present this webinar is because of what happened to a person named Reese Knight. Reese's family members are aware that I'm presenting this webinar and generously gave me permission to refer to her. I know many people with disabilities are aware of what happened to Reese, but I want to explain her situation briefly for those who don't know. And everything I say here can also be found in media reports about Reese. Reese was a person with cerebral palsy who lived in a staffed home for people with disabilities in Surrey, British Columbia. Due to her disability, Reese was unable to speak and she communicated non-verbally. Many people were unable to communicate with her at all, but her family members and the staff at her home, who had known her for many years, they were able to communicate with her. In April 2020, near the beginning of the pandemic crisis, Reese was taken to hospitals because she had symptoms that appeared to be related to COVID-19. Under normal circumstances, her caregivers would have stayed with her throughout her time in the hospital. But due to the risk of infection from COVID-19, hospital staff decided no one could accompany Reese into the hospital, not even her family members, and not the caregivers who had known her for years. These were the only people who knew how to communicate with her. I think it would be difficult for anyone to be alone in the hospital, but it would have been especially traumatic for Reese because it meant that there was no one around that she could communicate with at all. There was no way for her to convey how she was feeling to her doctors and nurses. Hospital staff ran tests and determined that in fact Reese did not have COVID-19. It turns out she had an unrelated respiratory problem. But even after the hospital found out she did not have COVID-19, her caregivers and support people were still not allowed to be with her because they were considered hospital visitors, and the hospital had banned all visitors. Reese's caregivers kept asking the hospital for permission to be with her, but the hospital staff said no. Tragically, Reese's condition deteriorated a few days after she was admitted to the hospital, and she died of a respiratory condition unrelated to COVID-19. Her caregivers and family members were contacted shortly before she died, and I understand they would have been allowed into the hospital at that point, but they couldn't get there in time. And so Reese died alone without being able to communicate with anyone around her. The circumstances of Reese's death caused a public outcry and received some attention from the media. And in response to that, in May 2020, the provincial government revised its policy on essential visitors in hospitals. I'm showing a slide with the most important parts of that revised policy from the Ministry of Health's communiqué dated May 19th, 2020. That's what they call it. They call it a communiqué. Now, I have some reservations about the revised policy, but in many ways it's very helpful. It says, hospitals shall continue to allow essential visitors only, and hospital staff get to decide which visits are essential. But it goes on to specifically say that essential visitors may include visits that are necessary for a patient's physical care and mental well-being, including assistance with feeding, assistance with mobility, assistance with personal care, communication assistance for persons with hearing, visual, speech, cognitive, intellectual, or memory impairments, assistance by designated representative for persons with disabilities, including provision of emotional support, and visits for supported decision-making. Now, I would say there's a lot to like about that policy, but the devil is in the details, and there are parts of the policy that are still concerning. One concern is that it says even for visitors who are essential, there shall be no more than one visitor per patient at a time. And I know that may present problems for people who often rely on multiple caregivers or support persons. I'm also very concerned that the policy still gives hospital administrators the final say on which visitors are essential and which are not. So even if you require assistance due to your disability, and your situation clearly falls into one of the categories listed in the policy, it's still up to a hospital administrator to decide whether your support person or caregiver can enter the hospital or not. If a hospital decides that a person with a disability may not have their support person or caregiver with them, and the person with a disability or their caregiver wants to challenge that decision, the revised policy says they may contact the health authority's Patient Care Quality Office. Now, some people are not aware of the Patient Care Quality Office, so I'm going to talk more about them in a moment. But first, I want to acknowledge that despite these concerns I've mentioned, I believe the revised policy is a big improvement on past practice. And to the best of my knowledge, ever since the policy was revised, there have been fewer cases of people with disabilities being denied access to their essential support persons while in hospital. But although there have been fewer cases, we have heard that the problem still keeps coming up. In some cases, people with disabilities are still having difficulty getting their essential support persons and caregivers into the hospital with them, even if it's not happening as often as before. And so next, I wanted to address the legal options available to a person with a disability who has been unable to have their support person or caregiver with them in the hospital or in another healthcare setting. First, I'll talk about the Patient Care Quality Office. This is one of the places you can go if you want to complain about a hospital or healthcare provider that will not allow you to be accompanied by your support person or caregiver. Hospitals and most other healthcare settings in BC are operated by regional health authorities, and every health authority has a Patient Care Quality Office, which patients can complain to if they are unsatisfied with their experience in hospital for any reason. It's not specific to people with disabilities, but it is one option for people with disabilities who have been prevented from having their support person or caregiver with them. The Patient Care Quality Office is a department within the health authority. If you submit a complaint, they will investigate it, and they may be able to give you more information about decisions made by healthcare workers. If you're still unhappy with the treatment that you received, you can also ask the Patient Care Quality Review Board to review the findings of the Patient Care Quality Office. The Review Board is a government-appointed agency separate from the health authorities. If they find your complaint is justified, they can make non-binding recommendations to a health authority or to the Ministry of Health about how to improve the way that healthcare services are provided in the future. But it's important to note that that's all they can do, and some people believe that their powers are too limited. For example, the Review Board cannot offer any compensation to people who face problems with healthcare services, no matter how poorly they were treated. And it cannot force a hospital or anyone else to do anything differently. They can only make recommendations. The Patient Care Quality Office and Review Board process can also take a long time. If you want to complain, you have to start with the Patient Care Quality Office, and they will take a month or longer to investigate your complaint. And if you want to request a review of their findings from the Review Board, that process will take even longer. So it will be a matter of several months between when you initially submit your complaint about healthcare services until the time when the Review Board may make non-binding recommendations about what happened to you. I should also add that the Patient Care Quality Office and Review Board process may not be available at all right now. Some of their websites, which are on the health authority websites, say that they are taking longer than normal to process complaints. And the Patient Care Quality Review Board's website is saying they are not currently processing any complaints at all due to the pandemic crisis. And that is obviously unfortunate. But despite these drawbacks, if a person with a disability was prevented from having their essential support person or caregiver with them in the hospital, I would encourage them to contact the Patient Care Quality Office. And again, you can find their contact information on the website of the health authority that operates the hospital that you visited. But I would also say if a person with a disability was prevented from having their support person with them in the hospital, I would say don't stop with the Patient Care Quality Office. I want to suggest another option in this situation is to consider a complaint to the BC Human Rights Tribunal. The BC Human Rights Tribunal was created by the provincial government to deal with complaints about discrimination and other violations of the Human Rights Code. As I said earlier, I believe the Human Rights Code requires hospitals to allow people with disabilities to have their support persons or caregivers with them in the hospital, even though visitor policies have been restricted due to the pandemic crisis. I have to acknowledge I'm on somewhat uncertain ground here, because to my knowledge, there are no previous decisions by human rights tribunals in Canada about hospital visitor policies and how they affect people with disabilities who require support from others. But I believe there's a very strong case to be made that people with disabilities who are denied access to their essential support persons or caregivers have been the victim of a human rights violation. So next I want to talk about the human rights complaint process. You can start the process by filling in a complaint form, which is available on the Tribunal's website at bchrt.bc.ca. You have to provide some background information about yourself, and you have to describe what happened and why you believe it constitutes discrimination. There is a deadline for submitting human rights complaints, and it is 1 year from the date when the discrimination happened. It is possible to get that deadline extended in some situations, but you can't count on an extension. So it's very important to submit your complaint within 1 year from when the hospital prevented you from having your support person with you. In a human rights complaint, the person or organization that you complain about is called the respondent. If you are complaining about being prevented from having your support person with you in the hospital, you are called the complainant. And the most appropriate respondent is usually the health authority that operates the hospital that you were at. And as it says in the slide, it is definitely a good idea to get legal advice if you are thinking about submitting a complaint to the Human Rights Tribunal. And in just a moment, I'm going to talk about where you can get that legal advice. Once you submit your complaint to the Human Rights Tribunal, someone from the tribunal may contact you and request further information. If the tribunal accepts your complaint, the respondent or respondents will be notified, and they will have an opportunity to provide a written response, and you will receive a copy of their response. What happens after that depends on what the respondents do, but it's likely that there will be some kind of mediation where the tribunal will encourage both parties to consider settling the complaint by way of a negotiated compromise. If that's not possible, there may be a hearing where you and the respondent have a chance to explain your position and ask each other questions. A hearing is a form of adversarial process, and frankly, it can be very stressful. But most human rights complaints are settled through negotiation or mediation so that a hearing is not usually necessary. If you do have to go to a hearing, the tribunal will make a decision about whether you've been discriminated against. If it finds that you have been discriminated against, the tribunal has a broad range of powers. For example, they can order the respondent to pay financial compensation to you as the complainant, and they could also order the respondent to change its policies and practices. Now, I think this is very important because I know many people with disabilities are interested in changing parts of the healthcare system, and the Human Rights Tribunal is in a unique position to actually make that happen. For example, in an appropriate case, the tribunal would have the power to force a health authority to change its decision-making process, or to ensure that its staff receive training about the rights of people with disabilities, if that's necessary to prevent further discrimination. Now, the Human Rights Tribunal services are free. You don't need to pay anything to submit a complaint or to attend a mediation or a hearing. You may choose to hire a lawyer, in which case you would have to pay your lawyer, but there are some options for free legal representation, though I should note there is no guarantee that these options that I'm going to give you will be able to represent you. One organization that may be able to provide free legal assistance is the BC Human Rights Clinic. Their website is bchrc.net. Another option is my office, the Disability Law Clinic at DABC. We can also provide free legal advice to people with disabilities who believe their human rights have been violated. Now, unfortunately, whether or not you have a lawyer, the human rights complaint process is not fast. From the time you submit your complaint until the time that you go to a hearing, if a hearing is necessary, you will have to wait at least a year. I know that is very frustrating for many people, but in my opinion, the human rights complaint process is still worth considering because, as I said, it may result in real change. That's almost all I have to say. I want to conclude by summarizing what I hope are the main takeaways from this presentation. First, if you have to go to the hospital during the pandemic crisis and you're concerned that your support person or caregiver might not be able to be with you, you should consider the strategies in the toolkit prepared by the Family Support Institute of BC at familysupportbc.com/COVID. But also, please be aware that the official Ministry of Health policy in British Columbia says essential support persons and caregivers are allowed into the hospital despite visitor restrictions associated with the pandemic crisis. But if you have been prevented from having your support person or caregiver with you in the hospital, I would recommend that you contact the Patient Care Quality Office for the health authority that operates the hospital. And if you are not satisfied with their response, you should also contact the Patient Care Quality Review Board. But I believe you should also consider a human rights complaint. As I've said, the Human Rights Tribunal has the power to make real change in the healthcare system if that's necessary to prevent discrimination. If possible, you should obtain legal advice before you submit a human rights complaint. As I've said, the Disability Law Clinic at Disability Alliance BC is able to provide legal advice about this issue. If you have been in this position as a person with a disability who has been prevented from having your support person or caregiver with you in hospital, please don't hesitate to contact us. We've come to the end of my presentation. I want to thank you very much for watching this webinar.